today's discussion is rather timely. If you saw the Windsor Star report, the Auditor General came out with a report which indicated that no matter what happens this provincial election, healthcare needs to be first and foremost on the agenda. I disagree with his findings with respect to cuts, and I'll talk about that a little bit later, about how we're going to get to the solution with respect to healthcare or make it better. One of the items you always hear right now is these LHINs, the creation of the 14 the LHINs, and there's a lot of attention with respect to, well, let's abolish them and get rid of them because they're just a bureaucratic cost to the system. Well, we have to take a step back. The LHINs are not perfect. They do need to be looked at, and changes do need to be made, but I caution throwing the baby out with the bathwater. When the LHINs were created, they were created in order to make some local accountability and some local involvement of voices locally. And you have to remember, when they were created, our economy was growing at about 3% a year. Healthcare was growing at about 7 to 10% a year, the cost. What the LHINs were created for, one of its primary purposes, was in order to spend that 3% and try to make it worth 7 to 10%. Try to bridge that gap between the two. One of the changes that I think needs to be discussed in hospitals and healthcare, instead of just cutting, because everyone just likes to cut. And what happens is if we're imposed with cuts, that'll result in cuts in services. So one of the issues we should be discussing is moving these ambulatory clinics out of the hospital setting and into the community and into a different setting. Clearly you're going to need them, but they do not physically need to be located in a hospital